Hello everyone, this is Brainless Medico and I am Dr. Manoj, and today we are going to learn one of the important topic in rheumatology, that is Scleroderma. Scleroderma. Definition goes like this. It is also called as systemic sclerosis, is a chronic autoimmune connective tissue disorder characterized by excessive collagen deposition, fibrosis of skin and internal organs, and it also shows vascular dysfunction. Individual feature has its individual clinical features. So we will learn that in clinical features. Okay. Then coming to, it leads to progressive involvement of it also shows other manifestations related to skin, lungs, GI tract, then kidneys and heart. Then coming to pathogenesis, the disease develops due to three major mechanisms. It may be due to autoimmune activation, autoantibodies stimulate fibroblasts, or vascular injury. In that, mainly due to endothelial damage or reduced nitric oxide or increased vasoconstriction, which leads to vascular injury. Then coming to fibrosis, excessive collagen deposition, skin and organ thickening. This results to progressive organ dysfunction. So I hope that is clear. Pathogenesis is very simple and clear, important, right? Then coming to types of systemic sclerosis, we have two forms. The one is limited, one more is diffuse. So what are the basic difference among these two are, there will be skin involvement limited to face, hands and forearms, whereas in diffuse it will be widespread skin involvement including trunk. Then coming to limited, it is slowly progressive, whereas diffuse is rapidly progressive. And limited, it is associated with CREST syndrome. In clinical feature we will learn what CREST syndrome is. Then diffuse, it involves early visceral involvement, and you need to remember diffuse is dreaded and poor prognosis will be seen in the patients. Then coming to clinical features, we'll go with the subtopics. Under skin, we'll see skin thickening and tightening, shiny bound down skin, loss of skin creases. Then coming to mask-like faces, sclerodactyly. Then coming to vascular, we discussed already what happens and what is the pathogenesis of vascular related. So those pathophysiology leads to Raynaud's phenomena. It is the earliest clinical feature. Then digital ulcers will be seen. Then telangiectasia. Then coming to GI system, dysphagia due to esophageal dysmobility. Then gastroesophageal reflux disease, in common word we will say acidity. Then malabsorption will be seen. Then respiratory, interstitial lung disease, pulmonary hypertension. Pulmonary hypertension is a very important topic. You can go and watch this video under respiratory system. Then renal, we have scleroderma renal crisis. Then severe hypertension, then acute kidney injury. Then cardiac, arrhythmias, heart failure, then pericardial effusion. You can go, every individual, these topics are very important topics. You can find them under the individual playlists. Then coming to, as I said, CREST syndrome will be associated with the limited type. So CREST stands for calcinosis, Raynaud's phenomena, esophageal dysmobility, sclerodactyly, telangiectasia. As it is, I said, limited it will be associated. Then coming to investigations, we have mainly two modalities, autoantibodies, then other tests. In autoantibodies, ANA positive in most patients, anti-centromere antibodies, it will be specifically positive to limited form. Anti-topoisomerase 1, it will be specific for diffuse. You need to remember anti-centromere specific to limited. Then anti-topoisomerase 1 will be specific to diffuse. I hope that is clear. Then other general test we can find for like as I said, other manifestations. For that findings we have to do other tests like HRCT of chest for lung fibrosis, PFT for ILDs, then ECG for pulmonary hypertensions, then CVS diseases, then RFT for renal related. Then coming to management, generally we do that in every video similar. First we'll go with the general, then individual treatment. So generally we will ask the patient to avoid cold exposure, smoke should be cut, no smokings, and even you people should not smoke. Skin care, Raynaud's phenomena, calcium channel blockers will be given or PD5 inhibitors will be given. Then coming to skin and organ involvement, methotrexate. Yeah, in rheumatology you need to remember methotrexate, mycophenolate, mofetil. You can write for everything. If you don't remember anything, just write it off, bro. They'll give at least half marks. Right? Don't say my name if it is wrong. Mycophenolate, mofetil, then cyclophosphamide. Yes, tell me where we saw these mycophenolate, mofetil, cyclophosphamide. Use the comment section. I'll be checking, right? Then renal crisis. For renal related, we'll go with the AC inhibitors. So at last, after reading all the story, what is the importance is like, if the patient comes with a limited sclerosis, then he has the better prognosis. Diffuse, he has a higher mortality rate. Then lung and renal involvement determines the outcome. Obviously, respiration and outflow excretion system, if they are affected, they play a vital role in maintaining the physiology, right? So let's revise quickly. Important topic, you need to revise well. Scleroderma, important topic in rheumatology. Definition goes like, it is also called as systemic sclerosis, chronic autoimmune connective tissue disorders, and we saw what is it is characterized by, what leads to progressive involvement of other manifestations. Pathogenesis, we saw mainly autoimmune activation, autoantibodies, vascular injuries, then fibrosis, which leads to progressive organ dysfunction. Types, we have two, limited and diffuse. Which is most dreaded? Yeah, poor prognosis will be seen in diffuse. Then clinical features, skin. Mainly you need to remember sclerodactyly because it is a part of CREST syndrome. In vascular, you need to remember Raynaud phenomena. It is related to CREST syndrome. In GI, you need to remember dysphagia. It's related to CREST syndrome. Then in respiratory, pulmonary hypertension, it is an important topic in respiratory, so you need to remember. In renal, you need to remember AKI, severe hypertension. Again, there are 5 markers you need to remember. Cardiac, arrhythmia, heart failure, pericardial effusion. You can't skip these videos, just go and watch it, don't forget. Then CREST syndrome, as we discussed, calcinosis, Raynaud phenomena, esophageal dysmobility, stereodactyly. Then telangiectasia, seen in limited, right? Not diffuse, it's a limited. Then coming to investigations, autoantibodies, specifically you need to remember anti-centromere and anti-topoisomerase 1, specifically where it will be positive, and other tests for other manifestations. And management, as usual, general, then Raynaud's phenomena treatment, then coming to skin and organ involvement, then coming to renal crisis, we'll give ACE inhibitors. So at the end, you need to remember limited will be better than diffuse. So which will be determined by involvement of lung and renal. I hope that was a bit lengthy video, but it would have helped you well. Subscribe for the channel for the more videos. Thank you.